Now I am going to talk about what are parathyroid glands and what is parathyroid hormone. Hi everyone, I am Dr. Prudwiraj, consultant endocrinologist at Arete Hospital, Gachibowli. In every human being, there is a thyroid gland located in front of the neck. Within the thyroid gland, there are 4 parathyroid glands. 2 are the superior and 1 lies on the superior right side, superior left side, and 2 are inferior. One is inferior right and inferior left. These 4 parathyroid glands secrete the hormone called as parathyroid hormone, that is PTH hormone. This hormone is very much essential for the normal maintenance of calcium and phosphorus in our blood. If there is any abnormality with the parathyroid hormone, then you can have either increased calcium or decreased phosphorus or decreased calcium and high phosphorus, leading to certain problems. And these problems are called as either hyperparathyroidism, that is, if the parathyroid hormone is excessively produced in the parathyroid glands, and hypoparathyroidism, that is, parathyroid hormone if it is produced very less than the required amount of parathyroid hormone. As I mentioned, if this parathyroid hormone is either excess or very low, then you can face certain symptoms. So what are the symptoms of excess parathyroid hormone, that is hyperparathyroidism? As I mentioned, if the parathyroid hormone is very much high in the blood, your bones can be very weak and easily fractured. You can have a bone pains or fracture, very easy fractures. Second thing is you can have a recurrent calculate, renal stones. And third thing is you can have a peptic ulcer disease or constipation and fatigueness and depression. All these are all the signs of excess parathyroid hormone in your body. And how to find out this excess parathyroid hormone? We do certain blood tests, especially fasting calcium, phosphorus, vitamin D levels and parathyroid hormones. If your calcium is more and the phosphorus is low with a increased parathyroid hormone, then we have to label you as hyperparathyroidism, and we have to find out the cause for this hyperparathyroidism. Most of the times the cause for this hyperparathyroidism is a small tumor located in either of the 4 parathyroid hormone glands, or in a very rare cases sometimes 4 glands can be hyperplastic also. We need to identify the cause by doing ultrasound neck or 4D CT neck or special scans like MIBI scan, and if you can able to identify the lesion, we can cure this disease by surgical parathyroidectomy. And if the patient is not ideal for the surgery, we may have to manage the condition with certain drugs. So if you are suffering with any of the symptoms I mentioned, like recurrent renal stone disease or recurrent hypercalcemia or fragile fractures, easy fractures, or peptic ulcer disease, constipation, and if your calcium is high and phosphorus is low, you need to do your PTH and consult an endocrinologist. And second condition is hypoparathyroidism. If your parathyroid hormone is very low in your blood, your calcium can be very low in the blood, which can cause certain symptoms like tingling, paresthesias over the fingers, over the mouth, and very severe hypocalcemia can cause fits, seizures and other problems. So if you are having any of these symptoms with a low calcium and high phosphorus, you have to do your parathyroid hormone and visit the endocrinologist. Thank you.